Welcome to A State of Sight. I'm Isaac Porter, and this is your update in ophthalmology and eye care. In this episode, I would like to go over several frequently asked questions that we often get about Lasik. Now, Lasik is a great procedure for the people who qualify, and many people wonder how long Lasik will last. The short answer is that we expect the Lasik treatment to last your lifetime, and once it's stable, at about 6 months or a year after the procedure. Now, for younger patients, once they get into their 40s, just like everyone else, they'll have to start using reading glasses in order to see up close. This is called presbyopia and happens to everyone, but the distance vision should still stay stable as long as the eye stays healthy. Later in life, people can get cataracts or things can change with the eye, and then there may be some changes, but not necessarily related to Lasik. Another question people often ask is the procedure painful or is there pain afterwards? Now, during the procedure, we use special numbing drops to help keep the eye comfortable, so patients should not feel anything sharp or painful. Now, they may feel some pressure during the procedure, or they will feel touch and some sensation around their eyes and their eyelids, but with the numbing drops, it shouldn't be anything directly painful. Afterwards, with the recovery, the eyes usually feel scratchy, feels like something's in the eye a little bit, but generally this resolves over the first day or the day after. During this time, the vision can be a little bit foggy, a little bit cloudy during the first day, but usually when patients get up the next morning, they're seeing much better. Other people wonder, what if my eye moves during surgery? Now, fortunately for this, with the laser, there is an eye tracker built into the laser system. So before every single impulse of the laser, which happens many times per second, the eye tracker is checking to see that the eye is lined up exactly in the perfect position for the laser treatment. Now, in addition to this, there's a target light for the patients to look at. This helps keep their eye lined up even better, but with the eye tracker, if the eye moves and is not in the right position, before the laser fires, it will cut itself off. This is a safety feature built into the laser, so the treatment will end up exactly where we want it. Then once the eye is aligned again, the treatment can restart. Other people wonder about the recovery after Lasik. That's a frequent question. And usually patients use drops for about a month afterwards, more at first, and first they'll start with an antibiotic and a steroid drop. Usually we'll only use that antibiotic drop for about a week, and then the steroid gets brought down over a taper over the first month. I'm sure there's plenty of other questions. We may have to do another episode about this in the future, but in the meantime, if you have any questions about Lasik, please post. We'll be happy to answer them, and we hope to see you again soon next time on A State of Sight.